Hi guys, hello my friends, hi everybody, folks. What's today's topic? STEMI. Okay, myocardial infarction, STEMI, non-STEMI, management. Okay, my beloved students, so commanders, take pens and papers to make your notes, and let's go. So when answering an exam question like this about myocardial infarction, STEMI and NSTEMI and their treatment, it's quite important to structure your response clearly and include key details. So let's go. Step by step, Define key terms. So what is myocardial infarction? So it's a medical condition where blood flow to the heart muscle is blocked, causing tissue damage. Why it's blocked? Because it's coronary artery disease, and coronary artery is blocked by what? By atherosclerotic plaque. So STEMI, or ST segment elevation myocardial infarction, is a type of heart attack or myocardial infarction heart attack characterized by a specific pattern on ECG indicating a full thickening blockage of coronary artery. And so we have a ST segment elevation in a myocardial infarction zone, also called transmural myocardial infarction. Non-STEMI or non-STEMI. Non-STEMI ST segment elevation myocardial infarction is a type of heart attack, a type of myocardial infarction of necrosis, where the blockage is not full thickness. So-called intramural or non-transmural myocardial infarction. So, and there is no evidence of ST segment elevation on ECG. Concerning what? Pathophysiology. So STEMI is, we understand it's highly likely that we have a coronary artery blockage, complete blockage, occlusion of coronary arteries leads to significant heart muscle damage necrosis. Non-STEMI, so-called partial blockage, intramural blockage, intramural myocardial infarction or non-transmural myocardial infarction causes less extensive damage compared to STEMI, but still poses quite serious health risks. Let's discuss the diagnosis. So anyway, we know that the gold standard is a troponin. We have a troponin positive. If it's a troponin positive, it's a myocardial infarction. No, it's not myocardial infarction. So once again, when we talk about diagnosis, STEMI shows ST segment elevation, while non-STEMI does not. And once again, elevated biomarkers, elevated cardio biomarkers, especially troponin, here are indicative of myocardial infarction, necrosis in both STEMI and non-STEMI. So why we divide these two myocardial infarctions? So it's actually acute coronary syndrome. Logic is that in STEMI we need emergent perfusion therapy or revascularization therapy. So means primary percutaneous coronary intervention is the preferred method, involving angioplasty and stent placement. Actually, it's a revascularization, but if you said reperfusion, it's not a huge problem. Actually, reperfusion with administered in STEMI when we have therapeutic window. So concerning therapeutic window, it's a time, preferable time to open the artery. So it's discussing, we talk about 90 minutes, 60 minutes, 2 hours, 6 hours therapeutic window when we can prescribe thrombolytics in STEMI, but not in non-STEMI. What else? Medications are the same, STEMI, non-STEMI, antiplatelets, anticoagulants, beta blockers, AC inhibitors. Statins questionable. So concerning non-STEMI, similar to STEMI, antiplatelets, anticoagulants, beta blockers, AC inhibitors, etc. But therapeutic windows is quite more than 6 hours. Like in STEMI, we have about 48 hours to understand. Risk stratification, we use so-called scoring systems like TIMI to determine TIMI to determine the need for early invasive strategies. But anyway, we know that we do not need, in quite majority of cases, in STEMI, or therapeutic window is 6 hours. and we perform reperfusion revascularization with stent placement, opening the coronary artery, PCI, revascularization, or we can use thrombolytics. In non-STEMI, the same technique, but the therapeutic window is 48 hours, so we have a lot of time to wait, and it's forbidden to use thrombolytic therapies in non-STEMI. So, myocardial infarction, commonly known as a heart attack, occurs when blood flow to the heart muscle is obstructed, causing tissue damage. There are two main types of myocardial infarction, STEMI and non-STEMI. STEMI means ST segment elevation. Myocardial infarction is identified by a distinctive pattern on ECG showing ST segment elevation, indicative of a complete blockage of a coronary artery. And non-STEMI, ST segment elevation myocardial infarction does not exhibit ST segment elevation. It usually results from a partial blockage. Diagnosis involves ECG and blood tests for cardiac biomarkers with elevated troponin levels confirming myocardial damage. Actually, you can say that next day, in vast majority of cases, STEMI finished with Q formatting of Q-wave myocardial infarction. Q means Q on ECG large, more than 0.003. Q means that we have necrotic zone and scarificating zone, connective tissue formation, necrosis, Q-wave, QMI, Q myocardial infarction. And non-STEMI, in vast majority of cases, finished with non-Q-wave, no obvious sign of scarring on ECG. So, my beloveds, largely sufficient, absolutely largely sufficient for your answer. Excuse me. Okay. See you in the next lectures. God bless you. Everything will be okay. Thanks God.